Hi everyone, my name is Shannon Vogel and I'm the patient navigator for the Duke Teen and Young Adult Oncology program. Today we're going to discuss some of the most common questions I get from teen and young adults regarding patient care. I have three providers with me today who will help answer these questions that frequently come up during a cancer diagnosis and care pathway. The first question is for Dr. Kelly Acharya, who is our reproductive endocrinology and infertility specialist and co-lead of the Onco-fertility steering committee here at Duke. Next, we'll have Jeffrey Vaughn, who is a medical family therapist and art therapist for the teen and young adult oncology patients within the Duke Cancer Institute. And finally, we have Mallory Thompson, the program manager of the Duke Cancer Patient Support Program and Sexual Health Services. Dr. Acharya, what is fertility preservation and how can cancer treatment impact fertility?
Thanks, Shannon. So fertility is the ability to create or produce a pregnancy. In other words, the ability to get pregnant or father a pregnancy. And certain cancer treatments like chemotherapy and radiation can affect a patient's fertility. These cancer therapies affect each person differently based on the type and dose of chemotherapy, whether or not they need radiation, the patient's age. So an important first step when a patient meets with the fertility preservation team is to talk through their individual risk to their fertility. Women are born with a limited number of eggs in their ovaries called their ovarian reserve, and this includes all of the eggs they're ever going to have. So if a cancer treatment decreases or completely knocks out that person's supply of eggs, they typically won't grow or release more eggs over time. So because sperm and eggs are vulnerable to cancer treatment, fertility preservation is the process of collecting some eggs or sperm before they're exposed to cancer treatment to deep freeze them for up to years until that patient is ready to use them. I think it's also important to mention that if a patient didn't undergo fertility preservation before cancer treatment, they may still have the option of undergoing fertility preservation afterwards. For example, if they think that they'll need more cancer therapy later, or they may still find it helpful to talk with a specialist about ways that they can build their family in the future.
Awesome. Thank you so much, Dr. Acharya, for speaking to us about that. And next, I'll hand it over to Jeff, the medical family therapist for our program. Jeff, do you mind telling us a little bit about your role in the program?
Sure, thanks, Shannon. So my name is Jeffrey Vaughn, and I'm a medical family therapist and clinical art therapist with the Teen and Young Adult Oncology program. And I provide supportive therapy for cancer patients, their partners, their family members, basically anyone in their care sphere, care system. And I provide these services before, at, during, and after diagnosis and treatment. So we really catch patients and their caregivers along the whole experience, sometimes seeing people quite a while even after their treatment is over as they adjust to life back after their treatment. We typically, some of the issues that we find teens and young adults want to deal with are a great sense of isolation as they adjust to the illness, not really having any peer support because there's so few of their peers out there who've had this experience. Isolation from family because family members and other caregivers don't really know how to support them. Deal with feelings of frustration, feelings of sadness as a result of physical and intellectual changes that they experience. Sometimes patients and their family members want to talk about feelings related to their mortality, to the patient's mortality, and end-of-life issues. And often we also really can help people deal with changes in their school life and their professional life.
Next, I'm going to hand it over to Mallory Thompson, who's going to tell us a little bit more about sexual health.
Great, thank you, Shannon. Yes, sexual health is an extremely important topic to discuss associated with cancer diagnosis and a cancer treatment. Many people experience changes in sexual health due to cancer and during a cancer treatment. It's important for providers to have conversations with their patients about their sexual activity and what is safe and what is not safe for them to partake in with a partner who is sexually active during a cancer treatment. The impact of cancer can include changes in relationships, intimacy, sexuality, sexual functioning, reproductive health, body image, and many other factors. So it's important that our services provide patients and their loved ones with a place to talk about some of those changes and a place to help cope with the impact of cancer on their individual sexual health, but also their sexual relationships with their partners.
Since we started the program in January, we've reached over 60 young adult patients and received over 25 onco-fertility referrals. Thank you to our providers for addressing these questions. And for more information on the Duke Teen and Young Adult Program, you can go to dukecancerinstitute.org/TYAO.